It's my distinct pleasure to introduce a colleague of mine, a mentor, Dr. Kakit Hu. He's a Wallace Adenberg Professor in Integrative East-West Medicine and the founder and director of the UCLA Center on East-West Medicine in the Department of Medicine of the David Geffen School of Medicine. He's a chair of the Collaborative Centers of Integrative Medicine at UCLA. He's a fellow of American College of Physicians and internationally known as an expert in East-West medicine and really practices East and West and West and East. So let me welcome Dr. Hu.
Good morning. It's such a pleasure to see so many of you. As I thought about earlier, like 20 years ago, I actually had my first conference on integrative East-West medicine. And I'm so glad that in 10 years, you already get to put something together with this scale. Congratulations. And I'm so glad that you're all here, and I'm pretty sure that you would learn a lot of not just techniques, but also kind of get some new ideas of how you will learn to continue with your path in your life and also in your career. So it would be difficult for me to try to summarize my 40-some years of thinking in what I'm going to be talking about, but I would try, and I would hopefully give you some tools that you would keep yourself healthy, because many of you need to understand how to keep yourself healthy, particularly for those of you who work in mental health, and most of you really are under a lot of stress, because your clients, your patients would kind of need you to help them go through their crises, and many of you are actually going to be sort of share that type of pain, and it's very important for each one of you to find ways to handle that effect, negative effect of stress on you. So my journey started in the late 60s. I came to UCLA with the idea that I would find a new drug from the Chinese herbal pharmacopoeia like Toyoyo, who got the Nobel Prize last year. But instead, in 1971, after chemistry degree at UCLA, I got into medical school, and that whole I would say, getting together of China and the US have shaped my whole career the last 45 years. So acupuncture was, when I was growing up in Hong Kong, I never experienced acupuncture. I have experienced Chinese herbal medicine, I've seen Tai Chi, I have gotten massage, but I've never really seen acupuncture until I was at UCLA Medical School studying neuroscience. And I was very intrigued by how a small needle in someone's hand would be able to help people go through surgery. And then I looked into what China has been doing, because I didn't know much about China, actually, even when you were in Hong Kong. All I knew is that when I came here during the Cultural Revolution. But then I realized that China, since 1955, has been embarking on blending Chinese and Western medicine to build a new medicine. So that has become my dream. That has shaped my whole career. So I spent my spare time during medical school at UCLA, and maybe spent about a quarter of my time studying Chinese medicine, trying to see how Chinese medicine can be blended with Western medicine through modern scientific investigation. And that sort of led me to sort of appreciate, as I understand the theoretical construct of Chinese medicine, and then try to compare with the Western, medical model. It's very, very interesting, because you have to begin to kind of look at the limitation of the current health paradigm with the linear thinking, the biomedical model, the emphasis on surgery, the emphasis on medications, and but I know that I need to build up my knowledge of sort of both medicines before I start opening up my mouth. So I specialize in internal medicine, and I subspecialize in clinical pharmacology, a new field to allow me to integrate both clinical medicine and also basic science. And I see a lot of drug-induced diseases. I know that there are a lot of diagnoses have been made, but no good treatment. So after sort of finishing up my training, and I taught clinical pharmacology for 13 years. And in 1980, David Eisenberg, who is a pioneer in this country in sort of promoting integrative medicine, he published a landmark paper in the New England Journal in 1993 about the prevalent use of unconventional medicine. That was 1993. And he told me that, and at that time he also went with Bill Moyers to China to film that whole series. And so I basically, for 3 years when he was a resident at UCLA, we talked about, well, let's do something together. So actually he later on went back to Harvard and established, the OSHA Institute of Integrative Medicine. And but I would say that if you look at his book, I think his book is an interesting book. They talk about Qi and Qigong, and I would say that part of what sort of I learned from early 1970s to 1985 when he published the book, partly would be my ideas would be shared in that book. So there was him in 2011. So we all both get some white hair. So let's kind of talk about why we are in the midst of a healthcare crisis globally. It's not just the United States, globally. Because I think biomedicine has been very successful, which is really mainly geared towards acute crisis care. And basically with the ICU and the hospital, a lot of people that used to die with from trauma and functional infections are now living much, much longer. So we are now talking about chronic illnesses. And the whole biomedical model, I don't think is adequate to allow us to solve many of these problems. We are now talking about management, okay? And you are going to have more and more need to manage more and more people. So this system is unsustainable. And I will talk a little bit about why there's an urgency for us to get the whole sort of workforce in healthcare to be transformed in their thinking, in finding tools to solve problems. So for some of you, I think it's very important for us to understand what really is complementary alternative medicine. How does it differ from the conventional biomedicine? So this is a definition put together by Axel Ernst. He's the first endowed chair in England. And I think that this is almost like, how many years ago? Almost 20 years ago. It talked about this medicine complements mainstream medicine and contribute to a common whole by satisfying a demand not met by the current model, and also by diversifying the concept of framework of medicine, really looking at the whole, looking at using systems approach to look at problems that are too complex for the current model to solve. So this is the roughly the NIH. It's no longer called NCAM because they now changed the name to Integrative Health now, medicine and health. So I focus on traditional Chinese medicine, but Ayurvedic is also a very, very important discipline, and that and then the reason why I want people to understand another systems of medicine is because of the theoretical construct, the philosophy behind it. There has to be a philosophy to guide the practice of science, and then medicine for that matter. So Chinese medicine basically with a theoretical construct that guide the practice of acupuncture, qigong, diet, herbal medicine, and structural type of approach to medicine like massage, chiropractic, osteopathy. So that's the classification. So what are the key characteristics? Very important for us to understand that the current biomedical model is a reductionistic model. We try to analyze from the symptom to a person's organ, to a tissue, to a cell, to a molecule, for us to either remove, block, replace, stimulate. That's the biomedical model, okay? So whereas the other medicine, the healing practices are more systemic. They try not to break up the whole into parts, right? So then right now the whole movement is not CAM or integrated medicine, it's like wellness. So that's sort of one of the characteristics. And the important thing is really for people to recognize that the body has self-healing capacity. In Western medicine, we basically use the drug thinking to look at the concept of placebo. Say, well, let me see whether the drug has any specific effect in addressing a specific etiology. And then the placebo is just like, well, whatever the body would do to heal itself. You have to be better than the body can heal itself. But the other approaches actually accentuate this body self-healing mechanism. So I think that medicine is slowly moving into energy, but obviously we're still anatomic and chemistry, and we're not getting into energy yet, but I think that we all know energy therapy is very much, but then, laser is energy. When people get electric shock therapy, that's energy. This is a very, very strong, intense, versus very, very low level energy, like a TENS unit. Right now, you use TENS unit, you can actually treat many, many problems. So nutrition, and then the idea about individuality is to recognize the complexity of the system constantly changing, that you have to adapt your approach. So I have been following China's work, and I have actually followed Professor Toyoyo's work since the 1970s, when China embarked on finding new solutions for malaria. And so by about 2006, I worked on a project on visual history. I interviewed the pioneers of integrative medicine, first in China, but also in the United States and other countries as well. So Professor Toyoyo actually ultimately get the Lasker Award, and last year get the Nobel Prize. But what she has done is to extract, from a Chinese herb that has been used to treat malaria, to now make it into a new group of drugs to solve the problem. But right now, because it's still a Western drug, it's just from inspiration from a Chinese herbal approach to find a new drug. But there's a lot more than Chinese medicine can do for infectious disease and many, many other diseases, okay? So Chinese medicine has an even longer history than the Great Wall. And it has been constantly being refined. And I would say the last 60 years is an attempt by China to encourage first many of the Western scientists and Western physicians, whether it's cardiology, oncology, and rheumatology, and so on, to try to understand how the two medicine differs, where they overlap, how can you put together and build a new medicine. So that's really what I'm working on, is to build a new medicine to present medicine in a whole different way by blending the best elements of both. So traditional Chinese medicine, many of you have eaten some Chinese food, I assume, right? But it's not, just the greasy type, right? But basically, Chinese medicine is really something that, in general, I would say a little bit more even superior than Chinese cuisine. Because, but then, the needling and the herbal that is very bitter or yucky, right? But it's supposed to treat diseases and save people's lives, okay? Now, very importantly to recognize that Chinese medicine has never separated the body and the mind. But obviously Descartes tried to do that to prevent sort of a religion to kind of, affect, medicine. But the model is an energetic model, a functional model. It's not that they don't know anatomy. They basically know anatomy, but that not, as detailed as Western medicine, but because they try to look at this black box, that is a whole system, and how this whole system energetically are linked both naturally and socially, and that the body and the mind are never separated in the thinking. one way for the Chinese to recognize what the potential problem is take a history, do an examination. Right now, obviously, they're supplemented with other approaches like scans and lab tests to the point that people worry that they may be losing, the traditional skills. Just like what we are in Western medicine, we are not, doing as much physical examination anymore. So the idea about recognizing the pattern is important because the pattern is actually changing as time goes on, and also as the disease progresses, and also as the treatment modify the way how the body manifests itself. But constitution, the Chinese, actually one of my visiting scholars, Professor Yu Ting from Nanchang, you can look at someone's constitution. You can predict what type of diseases they may get, and also what type of diet they should be on, and how certain sort of treatment may be good or not good for a person. But anyway, this is how the Chinese medicine look at the changing pathophysiology. So it doesn't really matter how many label of diseases you have, and that we have labels, right? Every system have their label of what the problem, so we see a lot of patients who come in with asthma, rhinosinusitis, fatigue, and IBS, IBD, migraine, and depression, anxiety, but it doesn't matter. It all boils down to where's the imbalance, okay? Why is a patient having flow problems? You can have flow of energy, flow of emotions, you can have flow of blood, flow of fluid, okay? And then why is the body not able to maintain the balance and the flow? Your body is depleted. Most patients, when they have chronic diseases, you're depleted. And also many of us in the health professions are depleted by the demand of our work. So the way to approach it is, first of all, you have to understand the person, the environment they're in, the social environment, and I'm sure a lot of mental health issues, a lot of it started with social environment, all the way to maybe before they are conceived, in utero, and during childhood, okay, all the way. So I think the most important thing is to think about, well, how do you restore the flow and the balance? You have to individualize it. We have to hopefully change the person's lifestyle, optimize the patient's social environment, and then you have to individualize, and you have to sort of adjust your approach accordingly, not just one approach and so on. I think the problems are too complex for one approach to. So the idea about prevention, very important in Chinese medicine through millennium. Right now, we basically are dealing with problems. Look at Katrina. Look at Katrina. Look at what happened to New Orleans. If you prevent, right, we won't be able to see, what the aftermath, right? So prevention is very important, but we are not putting the money into prevention. Less than 1% of the budget goes into sort of prevention. So this is my thinking about what health is, and I think it is balance. We talk about homeostasis, and I think that we focus a lot on just the physical and not the rest, and that it represents our inability to adapt to stress. Stress is not just psychosocial stress. Stress is when the body is so depleted that you're not able to handle what your body, that we take for granted. People with fibromyalgia, why would some people get PTSD, some people don't? It's because you don't have the resilience. That's the beautiful work that Helen has been writing about. So 20-some years ago, Hillary Clinton was trying to push through healthcare reform. But at that time, there was a group of people from all over the world, maybe 2, 3 from each country, come together and talk about what are the goals of medicine. And I kind of see that right now we are using too many narcotics to take care of pain, and that led to the epidemic that now we have to deal with. and that we are not paying attention to care. Too much of the money is into the technology and not enough on the care aspect of it. And I think that also the prevention concept should be applied to prevention of unnecessary prolongation of suffering. Because right now I think that a lot of money is spent during the last few months of life. So I was going through midlife crisis in the night. So you probably went through that too. So the last 10 years. So for me, I was a professor in internal medicine. I was sort of a clinical pharmacologist and trying to help teach the country's physicians how to use medication better so that they have less drug induced diseases and so on. But I know that deep in my mind, my dream is to build this new medicine. So I basically, 1992, start talking about it. I mean, even though I talk about it in the 70s, but really, I decided that I need to get out of the closet. That's why I told David, your paper is coming out. All right, I'm going to set up the Center for East-West Medicine. So that's basically what happened. So 1993, 94. I established the Center for East-West Medicine. I went to my chair, and he said, "Kid, sounds like a good idea, but I have no money." I said, "Okay, all right, let me do it. Let me raise the money." So I raised the money to build this center. I didn't get a big endowment like the OSHA Institute, UCLA or Harvard. I built it with just raw hands at that time. But I have something that's very variable. I have Dean Sherman Mellenkopf, who is my mentor for like 40-some years. I'm going to meet with him in like a week or two. And he basically is a body-mind, he's a gastroenterologist. He's a body-mind sort of thinker. And so he already retired. He was the one who said he'd go into clinical pharmacology. Because I was debating between clinical pharmacology, nutrition, and so on. But what happened is that his letter for me shaped my whole work the last 20 years. So we now have like many programs, and I would kind of talk about both the clinical and maybe a little bit about the education. At UCLA, we have many centers of integrative medicine, and I've been chair for the last 10 years, and I just recruited Helen to be part of this important I would say focal point for moving integrative medicine at UCLA. But in the rest of the country, there are many other centers as well, and there are other health systems are moving into this area as well. So integrative medicine is a practice of medicine that reaffirms the importance between the practitioner and the patient, focus on the whole person, and that you need to sort of make use of all appropriate therapeutic approaches. So these are the characteristics of integrated medicine. And there are a lot of different definitions, different models, but again, holistic, leveraging the body's ability to heal itself, emphasize prevention and wellness, and there are different models. I think that there are models of international buffet. There are many centers that have different type of approaches, like in medicine. It took a long time for a good internist to quarterbacking a patient with all the different, and then now you're adding other approaches. So instead, what I've done is first integrate Western medicine with good internal medicine and geriatrics, and then try to figure out how Chinese medicine's whole systems approach can be brought into this new patient-centered model that we have developed. So by virtue of having the way to sort of analyze the situation, knowing what approaches can be used synergistically, not antagonistic. So we have just more tools to allow us to solve problems. We in general use Western medicine to look at the trees, the branches, the roots, make sure that we're not missing anything. And if there's something that Western medicine can be used to treat, but there's a lot of that we don't know how to treat. We just keep doing testing and we don't know how to treat. There's also a lot of things that we think we can treat, but you can still optimizing it by decreasing the side effects, the cost, and so on. So the best of both worlds, this is our framework, is we use Western medicine to sort of diagnose and acute management. Sometimes you use the powerful guns of narcotics or steroids to stabilize the situation, but then you want to find out where the body is so depleted, where the imbalance is, and allow the body to adapt to the stress. You minimize the stress. And we talk about many of these things, but really look at the root cause. A lot of root cause, I'm sure, as the mental health professionals, many of you would recognize that many things are psychosocial that you sometimes cannot change, but at least you can see. What I've taught the patient is that try to change what you can change. When you cannot change, let me teach you something that you can adapt and prevent the negative effect of that stress on turning on your body's sort of harmful pathophysiological sort of pathways. So we now have physicians who are UCLA, USC, Yale, and Johns Hopkins trained internists to learn 2-year fellowship in integrative medicine, and also we have acupuncturists, massage therapists who are also trained in integrative medicine. We really would like to get mental health professionals, fitness, nutrition, to really bring many of what we do right now into a more comprehensive system. So we have more than 500 physicians refer to us. We basically are the clinic of last resort for UCLA. And so because we have a whole person systems approach. So right now, I am bringing the work, not, allow patients to come so late. I'm now building a primary care East-West program. I want to train primary care clinicians. It doesn't really have to be physicians. So we have nurse practitioner program. I've trained some nurse practitioners. And because using the current biomedical model, you are not going to be able to solve problems, that present to us. Just one condition with this young, graduate student who actually now has been able to finish a PhD as a clinical psychologist and do research. You cannot use the current model. The current model is too simplistic for the complex problem that we are dealing with. Because William Osler is the father of modern medicine. He recognized, obviously, the importance of knowing what sort of patient has the disease, than what sort of a disease a patient has. Patient have too many diseases as people get older. You have too many people who are taking care of different parts of you, and you hope that the primary care internist or family medicine would quarterbacking, the care and the drugs, that you're now throwing at all these patients. So obviously, during the time of William Osler, we do not have all these drugs. I mean, drugs are very useful, but they are two-edged swords, okay? So very importantly for us to really get a good history of the person, try to understand what is going on, and I think that prenatal may be even important, or utero, not just child experiences, their work, what type of work? I mean, to me, where do they work? What type of work do they do? What's the environment they are working in? All these have clinical diagnostic importance. Not the average good Western nutrition. Many people do not have the right nutrition for your constitution, okay? And then your exercise. Exercise is also a two-edged sword. I see so many people damaged, by their inappropriate exercise. So now we basically cannot do full Western and full Eastern because we are an insurance-based practice at UCLA. So we have to be, in a sense, UCLA is self-supported, all the health, the whole health system. So, but anyway, we basically teach our residents and fellows and students, and unfortunately for mental health, you don't touch the patient, but really touching the patient is very important, both therapeutically and diagnostically. And it's not just for patients, fibromyalgia patients, they have all this pain. But a lot of people, if they don't have pain, they don't present as fibromyalgia. They will present with other diseases that are non-pain. They could be dizzy, they cannot sleep well, they have reflux, they have other diseases. But everyone, if you tell me what diagnosis or what disease or symptom, I know exactly where your body have a knot, okay? So anyway, we try to understand the person, let them know how in their whole life, get to where they are. How can we help them rebuild? How can we help you rebuild, right? Why, you need to sleep better. They need to be able to eat appropriately. They need to exercise appropriately. They basically are taught how to do stretching and how to do self-massage, and then how do they handle stress? For a lot of women, okay, over the years, I think that crying is a very important approach to treat many problems. Unfortunately, a lot of women nowadays are not able to cry at work, okay? So I teach them that go to the restroom, you shed a couple of tears, you quench the fire. Because what happens is that there's all this tension, and you basically swallow it. Then you get your reflux, your migraine, and then worse is to get the autoimmune diseases that I see, okay? So I think lifestyles to really look at even how they dress. Some people, I mean, they walk barefoot. They expose their neck so much and their belly. When in fact that is not a very good way if you are already so depleted. Okay, so we basically use something very safe, very simple. I mean, using herbal medicine in a place like UCLA with people on so many drugs, they're so sick, would be legally difficult, at risk, financially not viable, because basically you can treat many conditions using simple teaching the patient what to do for themselves, how we can do for them, and using ways to take care of those knots, okay, in the body. Each one of you have their knots in your neck, in your back, right? And so education is a very important component of our sort of successful way to help our patients, because unless someone learn and conceptualize and think that they can help themselves, and we give them the tools to help them to adapt, to stress, because oftentimes, it's not. Sometimes it's just mechanical stress. Driving in 4, 5, and 101 and 10 give you knots in the neck and the back, and give you road rage. Okay, when you are having road rage, you have inflammation. I mean, inflammation is central to 80% of chronic diseases, right? So you have to basically try to deal with anger, right? Because most people anger in, not anger. You have to express it, okay? So this is good Western medicine. There's a whole body of knowledge on lifestyle medicine. We need to really encourage people to learn how to lead better, healthy, living sort of ways. So this is a slide borrowed from, I think, Dr. Michael Irwin. And Bruce McEwen, he has been sort of advocating the concept of allostatic low for, God, good 20-some years. He published a nice review in the New England Journal. But I was told that many of our medical students and our residents have not been exposed to this, very, very simple concept, which actually explain a lot of things what the Chinese have been talking about in terms of when the body gets stressed, you adapt to it, and you get more and more, you are not able to adapt. Then all the different pathways come. So some people with the wrong genetics, boom, they start out almost like from, actually that's not true, because I saw a patient who came to me, stage 4 lung cancer. Well, what East Westman can do? But he said, well, I don't have any problem. But when I examined the guy, his neck and shoulder is so tight. And he said that, well, yeah, I've not been able to sleep flat, So the neck and back, if you have neck and back tightness, beware, okay? Because it is not a simple orthopedic problem, okay? This is a marker of how your body is adapting to stress, right? So, So over the years, I've seen people come in. I see someone, okay, well, you are at risk. I predict almost that you can go to fibromyalgia if you don't take care of yourself, okay? Or they can go to those with little Hashimoto thyroiditis, boom, okay? The thyroid experts would just, oh, we'll replace you. But realistically, these people later on, they come back because you never address the stress effect on disturbing the immune system. So you get autoimmune disease from it. You see people coming with multiple sclerosis, lupus, RA, and so on. And some will get with cancer and strokes, and then they get a treatment, and then they get into fibromyalgia. It's very simple. Medicine is so complicated right now because we are always trying to think about a drug molecular solution. When in fact, we can go back to basic history, physical examination of the patient, and try to spend time educating the person. So chronic stress linked to inflammation and disease. And the body basically could be external inflammation when you all this grill, fast food, right, and barbecue. All this would enhance inflammation to anger. Anger is basically your blood boil, right? So what does it mean? You can do all kinds of cytokine biomarkers. So stress management, obviously, you're all experts, so I don't need to belabor it, but I think crying, I just want to keep emphasizing that get your patients to cry. There's very little research on psychophysiology of crying. I have one of my students to look into that. So let's spend like 2-3 minutes on acupuncture, okay? And I want you to take home some tools for you to take care of your neck and back problem, right? The neck problem for sure. So if you kind of look at acupuncture, maybe you say, well, God, you know, it's voodoo, you stick needle into someone. Well, surgery to me is actually a component of big-time acupuncture, right? It's the wound healing that really, so basically acupuncture is micro-trauma, okay? It basically have the body-mind response to heal, right? And it heal along, most likely, maybe fascial lines. That's why you can put the needle in different areas. So in a sense, later on, I'll teach you how to massage, parts of your hand to take care of your neck, right? You don't need to go to your neck, okay? But you can go locally, you can go peripherally. If you go just, sort of into looking at the literature, there are thousands of papers on acupuncture. There are more RCT trials for acupuncture than surgery that many of our physicians recommend, right? And acupuncture for sure is better than placebo. Placebo is about 30%. The right acupuncture point bring it up to about 70%, because there are some non-responders too. And acupuncture can be used to treat different diseases, not just for pain. And for sure, nausea, vomiting, and so on. But it really enhances the immune system. You can use acupuncture. I use acupuncture to treat people with bronchitis, rather than antibiotics that is not going to work for a viral problem. So acupuncture works by basically restoring the body's homeostatic balance, and it's just a way for you to send a signal to the body by needle or by other means to turn on the body's own healing capacity. So I'm pretty sure you have put your hand on your head and your neck before, right? That's acupressure. Those are the local acupuncture points. Moxa smells like marijuana, but when I first learned acupuncture in the early 70s, when you use moxa, it's an herb that you provide heat and stimulate the points. And now you can use TENS unit. I've seen TENS unit going from a few $100s to $20, $30, $50. But now you just have something that you can plug into an iPhone and you can stimulate, put the pad on your neck, on your back, and stimulate. So trigger point is a Western medical approach, but then we basically know how to put the two together, integrate it so that if you tell me what condition, I know where the trigger point is. And you can do trigger point for physicians. You don't need to basically learn all the archaic language of acupuncture, Chinese medicine. Then a lot of patients come in with their pain. They put, at the painful areas, and that's the salon pass that they are advertising in CNN or Tiger Balm and so on. But you can do cupping. I don't know whether anyone have seen, Gwyneth Paltrow, who had cupping, right? And then you see all this Nikki, in their neck. But people are now using laser, using magnets, and so on. So a lot of research, at MGH, did some of the beautiful work on looking at using functional MRI of looking at how acupuncture works, in terms of its modulating the limbic system. So that's why most of the patients who are responded when you do acupuncture, they all would just either fall into a sleep or they would feel like they're floating. So because you really release, to me it's releasing endorphins and probably, serotonin and so on. Because acupuncture basically do not, work by itself. It basically works through some mechanisms. And so we can use it to help patients, when the stress is down, their blood pressure, gets better, they sleep better. So when you address a patient, make them eat right, sleep better, and having, the right metabolism, and make them move, because when they're pain, they don't want to move, they eat wrong, and it's a vicious cycle, and it decreases inflammation. The vagal nerve is involved in modulating the whole inflammatory cascade. And that's the reason why very important for us to make sure that we do things enhancing the vagal and not sympathetic. A lot of people, when they work, they're already on sympathetic drive. And then after work, they go on doing the wrong thing in terms of exercise. So this is work done by Catherine Huey at Mass General. I think she recently retired. But this is using acupuncture on LI4. I'll show you later on. And and then Kevin Tracy, really a major figure in advocating the hypothesis about vagal nerve modulation of the inflammatory cascade. He is talking about they are now doing vagal nerve direct stimulation. No, you don't need to do that. You can use massage. You can use acupuncture. You can do stretching. You can use just different ways to modulate the imbalance between the sympathetic and the vagal. So every time there is a nice, we are already very busy. We have a 4 or 5 month wait for any new patients, even though we start at 7 o'clock and finish at 5 and 5 days a week, and we have 3 clinics. But every time a positive study, or this is not a study, this is almost a combination of studies to talk about acupuncture is useful for chronic pain. Right? And it sort of get more people who want to come into our clinic. But acupuncture is much more than just taking a pain. But even though if you can treat pain and avoid the use of NSAIDs, avoid the use of narcotics, avoid the use of steroid injections, you are making a big, a favor, for your patients. So there are a lot of good studies on, trying to understand the mechanism of acupuncture. We did actually a study on acupuncture inhibiting sympathetic activation during mental stress in normal students, but also in patients with advanced heart failure. So right now, rather than using acupuncture, we are going to evaluate this using other means of stimulation. If you want to know more about acupuncture, you can go to our web portal, exploreim.ucla.edu. We have a 21-minute sort of a clip on acupuncture from east to west. They use acupuncture on the tummy before sort of cardiac surgery, and in Guangzhou. But basically, we interview many of the pioneers in this field. So during the rest of the 2 days, there are lots of sort of talks on yoga, on meditation, and dance and art. So it's sort of I don't want to belabor into areas I know very little about, but we do refer patients, and we train our students to know about all the various other modalities. And then obviously mindfulness meditation is a very, very useful approach that the Mark Center is doing. And I would say a few more words about Tai Chi. I think Tai Chi has been around for several thousand, well, I would say Qigong has been around for several thousand years. Tai Chi has been around a lot, less number of years because it's just a brand of Qigong manipulating Qi. It's like work to manipulating Qi. So Tai Chi is a moving meditation. We did a study on how to use Tai Chi to help patients with tension headaches. We also was interested in how it would decrease sort of blood pressure. But it really, Dr. Michael Irwin talked about how it enhances immunity, but also can rebalancing, immunity as well. Pain, Professor Wang, a rheumatologist at Tufts, have done work on fibromyalgia patients and for Parkinson patients with the fall risk. Dr. Lee at Oregon has been able to demonstrate its value. They are published in New England Journal, so these are all very, very prestigious. And obviously, our own Dr. Helen Levesky did a beautiful study on showing Tai Chi Chuck, which is a modified form of Tai Chi, would augment drug therapy for geriatric depression. So let's go to some hands-on. Okay, how many of you have things that I sort of list here? Some people have visual issues. I have a program to help people with eye problems. I program to help people with ENT problems. People have ringing in the ears, they have dizzy, they have, and then GI is whether it's corkscrew, esophagus, IBS, IBD. People have recurrent sinusitis. People have recurrent infections. They couldn't sleep. I mean, these are all sort of intertwined. It's not causal. But you have this, your neck is tight. Your neck is tight, you are at risk for all this, all right? Posture, make sure that all of you sit up straight, okay? Because this is one thing that I always tell my patients. You put your head down reading, right? You put now the kids are now having more and more, problems, earlier because their head is always down. When your head is down, do you know how many pounds? How many pounds is your head? On the poor muscles in the neck, 60 pounds. If it's like upright, it's 12 pounds. So most people basically are, that's why when you are an internist primary care, you come in, oh, they have this. Well, they have neck pain, they have migraine, and then you give a pill, you get this, you get a pill. Well, I take care of your neck, and many of these problems can get better because the body can take care of itself, because the vagal nerve. Look at the neck has all these structures. So it's not just a physical therapy, physical medicine problem. It's not a pain clinic problem. There are many things that lead to those tender points, trigger points. And so sleep, microtrauma, macro trauma, you live in LA, you get hit multiple times, right? You get, from the bad concussion all the way to just, mini rear-ended accident. You are no longer the same. Every time you get hit a little bit, your neck and back are already, okay? So, and that comes not just what is up here, down here, the low back pain is a major problem. Most people only worry when they cannot move. That's orthopedic. But your neck, the neck and back is tight, you better take care of it because it will manifest it in your gut, in your ovary, in your adrenal, okay? So, let's do something. Put your hand on your neck, okay? Crisscross your fingers and go against line. Okay. Try to get your hand and just massage, the occiput first, which is a very important puncture point. And you just go down and go through, look at the sternocleidomastoid muscle, the scalene muscle, and the cervixes, and the capitis. How many of you feel knots in your neck? Many of you, tight, right? If you say you don't have it, come to me, I'll show you. And you would jump, okay? Many of you would be dizzy, or your eyes sometimes cannot see. The watery eyes, dry eyes, dizzy, and sinus, allergic, rhinitis, some people I cannot swallow. A lot of women say I cannot swallow. I'm pretty sure in mental health, that, things seem to stuck. And you see them, the GI, and GI would then look at it and say, gee, I don't see anything. So this is not just for headache and eye pain, it's very useful. So for people who get like recurrent like colds, cover your neck, don't let wind blow at this. And then, see, when the wind blow at this, your muscle, tight, then you get postnasal drip, okay? And then you get a little headache, and then you cannot breathe, you get sore throat, right? And then you start coughing. I mean, protect your neck, protect your back. So also, knots in my shoulder, okay? Every one of you have knots in your shoulder right there. And people come in and say, oh, good, harder, right? This is very important. This is not just, when people would be, in Western medicine, they say when your gallbladder is in trouble, it go right to, that area, refer pain, but realistically, many things, would be tight over there. So this one, okay, now, those who are pregnant or at risk for pregnancy, don't massage this point. This point has been used to induce labor, but most likely at the end, before, they're ready, the baby's ready to come out. But this is a point that I teach all my patients, and also when you are having a difficult situation, particularly difficult client, put your hand on this muscle, not just a point. You just massage the whole second metacarpal. Now, just tell me how many of you feel like you have a knotty muscle there, or it's a very smooth muscle? But you must be tight because you have run a conference. So you should be. But if you feel tight there, okay, then you just massage it and see how you feel. Some people will feel very relaxed. This is a point where they do the functional MRI study. And then they do a lot of surgery using this point. This is a very useful point, not just for a headache, just for stress in general. So if you want, you can go to our web portal, Explore IM, and we'll go over the key points that we teach, our patients and our students. So it's very important to learn some of these points. I usually teach people 5 points to 8 points, and because if something happened and you bring your stock of medications, you will be done, finished. This will be with you everywhere, okay? And I think that it's very simple. You touch yourself every day, all the time, without knowing what you're doing, but learn where to put your hand on the right areas, both for diagnosis, prevention, and treatment. So I just recommend a patient to buy a massage chair. Say, this is the best gift for yourself. Not that, because now the chairs are so good, they squeeze your calf, they massage the bottom of your feet, they get your neck, your back, right? And then I teach them how to use the golf ball to massage the bottom of their feet. Most of your patients, mental health problems, their lateral thigh, IT band is very tight, okay? Most people with depression, anxiety, whatever, okay, their thigh and their leg. But because you're only dealing with the head, you don't deal with the body, right? You can use the body to treat the head, and you treat the head and take care of the body. Anyway, I have to finish because I'm over time already. So a lot of people are quarterbacking their care. I think that there's a lot of mixing. Maybe I think it's very important to train enough people to see how you can put things together in an orchestrated way. And I think that what I have worked out after 20-some years with the clinic at UCLA is my clinical laboratory to test out my model. So now I'm able to train my fellows, and they are now building successful clinic in Westlake and Torrance. And I think this model is very, very simple, safe, and effective, and affordable, and accessible. And so in our attempt to now globalize it, I am, I have been an advisor for Shanghai City, the entire 12,000 Western-trained physicians and public health and medics. They all are learning 6 months of Chinese medicine. So the whole entire, city for 24 million people, 242 clinics, they all take time to learn 6 months of Chinese medicine. So we have a summer course that we have been teaching people for 8 years. I've been teaching medical students at UCLA for more than 20 years. So that's why many of my current faculty are my former students. So they know the 500 physicians who refer to us. So this is what I talk about in Shanghai. They pick up my idea. They say, okay, well, why don't you sort of help train the 12,000 physicians? But I think that one has to redesign the clinic because most primary care doctors only have very little time per patient. So within my primary care East-West program, I basically sort of have allow my staff to have a little bit more time because looking at the whole continuum of care, Western medicine, as I said, is very, very good in saving lives, stabilizing the situation. And what is important is that we are not doing enough to prevent people going down that spiral because primary care has never been looked at as sort of a places where you move people back into a high level of functioning. It's always been thought to be just feeding the subspecialists for more testing, okay? And then for them to hold on to the patients in and out of hospitals. So I think that the other approaches basically aims at helping people to stay well, and that's the reason why a lot of money are not going in. So a lot of people are probably going to sort of use their own money to take care of themselves, and that's why there's a rise in interest in body-mind, in massage, in eating better, and so on. But I think it should be hopefully better integrated. So my own son, who's also a primary care internist and geriatrician, is heading the program on primary care East-West centers. We train our fellows to be trainers of this new brand of East-West. One of my fellows who's a junior faculty now bring my work to hospital medicine. I want patients to go in and come out quickly. Hopefully, they don't need to go back in again. And so I now have trained someone East-West public health to deal with population health. I want to distribute what I've learned to people globally through digital, internet. So this is my next dream. I think my first dream has been achieved after my 40-some years. So I hope that in the next decade or two, if I live as that long, it will hopefully get a better global health model. Because right now, if you look at every country is really going through a healthcare crisis because there's just not enough money to sustain the current model. And that's my sort of impatience right now because I see it, I talk about it for 20-some years, and WHO said, well, it sounds like a good idea, but we are not moving fast enough. The money is still sucked into the current biomedical model with the diseases and so on. Okay, thank you very much.
Any questions? Do we have an extra mic for questions? Okay. Any questions?
Well, while we're waiting, someone said, how did you come to see us? I think, let me know and I will see whether we can put you on a fast track wait list. Because really September is the next new patient appointment.
I'm very interested in a comment you made about giving acupuncture to the abdominal area before cardiac surgery. Where can I get more information about that?
That leads to another real obstacle of sort of making this available because many of the person who basically look at the abdominal acupuncture because of its relationship to the small brain, to microbiome, enteric nervous system, but it's all in Chinese. So I'm working on, that's why I work on an information center, but I need to build, I'm raising money globally right now to build this sort of a new institute, new school, because you need to get some of this information translated. To translate it appropriately, you need people who know both medicine, both language, and modern science. So it's not easy to translate what we translate for the web portal, Explore IM web portal. It takes a lot of time. But I can show you, like some of the Chinese literature if you're interested.
Hello, I believe your statement alluded to the fact that the primary factor in person's health is their social environment. Is that correct?
Well, I think social, natural too. I mean, like extreme heat, or even for people who are old or feeble or chronic diseases, just simple change in the environment, whether it's natural or social. It's not just, that's why it's not just social. The social is a big one, okay? At work, at home. I mean, just that's why when we talk to patients, say, what happened? When they're not well, I say, what happened? Oh, something happened at home. They have visitors who stay more than 3 days, or, I mean, so it could be a kid living home, to school, but social, it could be just like your kid was sent to boarding school. They get bullied. Okay? That's social, right?
So what is the best way to improve or bolster your social
Well,
aspects?
I mean, obviously, that's why I think a lot of the money should be, hopefully used to care of the social environment, right? So that people have work, people have a better way to exercise, better, safer, and so on. But I think that what I'm trying to say is that if you cannot optimize, they cannot change. I mean, I have people that quit the job as, well, I'm a nonprofit, I'm on 3 nonprofit, as a consultant and not be the one, running it, okay? But you have to teach them what they can do, and you use the model that I used to negate the negative effects of that stress on the person, that turn on the bad pathways.
I wanted to ask you if you are addressing the business model of how medicine is practiced today, as it is negating the whole concept of integrative medicine because there's no financial incentive, or the financial incentive in today's model does not exist or minimally exists.
No, I think that things are changing. I agree with you 20 years ago, but now, why do you think we have to go through healthcare reform? We go through healthcare reform because before 16, 18, 20% of GDP are now dealing with the 80% of GDP, right? The 80% GDP say, well, I cannot afford it. I cannot compete globally. That's why the United States has to go on healthcare reform, because we are always exporting, to other countries. Other countries are using 5, 6, 7, 8%, and they have much better health services, right? So UCLA, I mean, when I first started, obviously, right now we're still fee for service, but we are ACO right now, okay? Then why is Kaiser now, after 17 years, they had a model, right? Because they focus on prevention. They to me, they are Walmart of healthcare, okay? They have a very good system, but they still need a new model, okay? You need a new model because most of the practice right now with the guidelines, the medical school curriculum, they are all based on the old model, okay?
Good morning.
I would like to ask you, has you considering the evolutions, and I'm calling about Darwinian evolutions when you are doing your studies? Because to me, I'm thinking that health is related more to culture. And I want you to make a comment, and the first question is, have you looking for evolutionary perspective?
Then you're talking about
Evolutionary perspective.
Yeah, evolutionary perspective. Well, I think UCLA has someone look into it. I think culture, I think the culture is actually what I think we have to deal with. And that's what I'm going to talk about at a World Cultural Forum next month.
For me, because I feel the paradigms, not only for medicine, but for living, is we have the regime that we have nowadays, the way we living is, and the way we thinking and the way we act, is what causing all this mess that we have here. I am that coming from the jungle of Latin Americans and having living in a natural environment and dumbfounded of the insanity that has been witnesses in this part of the world. Thank you.
I agree. We need to really look into sort of many other aspects of it, just not biomedical molecular, approach.
Good morning. I'm interested in putting more science and transparency into what works in the areas of integrative medicine, because a lot, it's taken us so long to prove that acupuncture works and so on and so forth. So if you were to design a study to look at how complementary alternative medicines can improve the recovery of, say, cancer patients post-surgery, head and neck surgery in particular, what do you feel is the most effective but the least studied way to enhance the recovery and to, besides acupuncture maybe because it's so well studied, what other modalities do you think would be the most effective at complementing head and neck surgery recovery but the least studied?
I think that, again, Helen is a very important sort of stimulus for bringing integrative medicine research methodology to enhance people's understanding of the limitation of the current research. So YouTube, again, you go to YouTube, CTSI, integrative medicine. Right. I gave a talk that outlined all the innovative methodologies, from whole systems research, comparative effectiveness research, to good pragmatic trials and so on.
So let me just use the microphone. We put 6 lectures on research on integrative medicine that we developed for CTSR research trainees, and it's on the YouTube channel UCLA Integrative Mental Health. And Kakit had a lecture there going over methodology, research methodology. We'll try to highlight as much as possible in every talk. We have to move on. So probably other questions can be answered individually or during networking lunch. We're also behind time. Thank you so much. So I suggest...